Welcome to the Rehab Remix.
Where we break down the hottest topics in ortho and neuro PT to help you elevate your clinical game. We're your hosts, Dr. Lauren Tide
And Dr. Lauren Young, bringing you practical insights straight from the evidence to your earbuds. You know what time it is? The mic is on, the vibes are right, and we're diving back in. This is where research meets real life and voices from the field bring it all into focus. Put your headphones on. It's time to remix.
Hi, everybody. Welcome back to the Rehab Remix. We are so excited to chat with our next guest. We have JT Doscher here with us today. So, JT, do you want to introduce yourself a little bit for our listeners?
Sure. Hi, everybody. I am JT. I am in New Jersey and I'm from here. I went to school in New Hampshire for PT school and then started working at a school back in New Jersey. I've had a couple of different gigs. Started traditional ortho out of school. There weren't a lot of pediatric opportunities. I graduated 8 years ago and now have transitioned about just shy of a year into pediatrics from there and have basically been there ever since. I worked in a couple of different places, schools, outpatient clinics, managed outpatient clinics, and I've also worked in outpatient hospital, which feels different than just a traditional outpatient clinic. So I have a ton of experience in a lot of different fields. I am in the most interesting part of my life right now, which is mostly being a stay-at-home dad with the 2 kids while my wife is working because that's what worked best for us, of course. And I stepped back from working in the hospital a few months ago and I'm with the kids and I'm doing some social media education on the side. And I had been doing that for some time and continuing to do that as I am home with both little guys, Margot and Theo.
Who make regular appearances on your social, and I love that.
Yes, they do.
So
Yes, they do.
yeah, thank you so much for being here. Welcome. You gave us a little insight of, your background, but tell us a little bit more about this journey to being more on this pediatric PT side of things. Did you always start there? What kind of made that influential jump? Because there's a lot of people out there that I think have this idea of what pediatric therapy is and sometimes what it isn't. And so I think hearing your perspective on where you started and what kind of influenced you to make that jump to pediatric PT would be really helpful.
Absolutely. I have always enjoyed working with and spending time with children, be it Little League coaching, babysitting, different things like that growing up. So I always gravitated towards hanging out with younger children if I, was with families and such. And it kind of came easier to me. My youngest brother was 10 years younger than me. And I felt a lot of my comfortability with being with younger children now as in my career is from really being 10 years old when he was a baby and getting all of that experience with him and helping to bring him up and things like that. That was where my affinity for pediatrics started. And then when I was in school and college at Elon, I was not sure exactly where I wanted to go. Really liked physical therapy, and I kind of just went into PT school with the mindset of let me learn as much as I can about all of the different career paths. The only one I didn't love was wound care personally. And I was just like, I loved neuro, I loved peds. Ortho was cool, but not my cup of tea. And I just liked how pediatrics kind of combined everything where you're getting the neuro, you're getting the ortho, and it's even more complex than that, but that's the oversimplification. But then having to make it fun, enjoyable for children to then be engaging with you, and that critical thinking where you're still doing all the same problem analysis that you would be on possibly adult patients, but now you're actually having to then create something fun inside of it or to get a child to buy in or work with babies or all these different things. So I had a really great mentor at Franklin Pierce University where I went, and I'm still in touch with her, and I do adjunct teaching with her now, which is awesome. And she really inspired me to continue to look into my passion and working into pediatrics. And here I am. It's a really fun mix that I really can't picture myself doing really anything else. I know some people can kind of pivot between different settings, different populations in different settings. I can pivot between different settings, but I can't really pivot between populations. Like I even used to, for example, this is silly, but when you have the family members that come up to you and they talk about like their ailments and things like that, I used to kind of entertain it. Now I'm just like, I work with kids. I don't even know what to do anymore. Like I just kind of I just pawn it off. I'm like, I don't even know. I don't haven't done it in years. So I'm very happy. It's really, really awesome career.
I love that. I feel like I have a lot of things that I can kind of connect with you on that because that is truly like where my mindset is. And when it comes to pediatrics, there's a lot of things that kind of encompasses pediatric PT. Dr. Young, do you have any questions that you want to throw in there for JT?
Yeah, I 100% agree with you. As I was moving, I've moved quite a bit, and as I was like moving jobs, I was like, you know what? If worst comes to worst, I'm a neuro person by trade, so I'm like, if worst came to worst, I just go find a peds clinic. There is neuro in that peds clinic. Actually, am enjoying getting into a little more peds later in my career. I remember year one, somebody was like, there's a 3-month-old baby on your schedule. And I was like, I will take your hardest patient. Do not give me that child. I like was not someone who grew up babysitting and all this other stuff. So it was not my thing at first, but with confidence and time, I'll see a kid now and try and learn about it, because it's not just Dr. Tig and I talk about that. It's not just adult therapy for a younger person. Like you have to have specialized skills, like you're saying, to be able to make it fun. They don't just
Yes.
usually do 3 sets of 10.
No, definitely not. Definitely not.
So,
No.
traditionally looking at pediatric physical therapy, like it's a lot of female dominated setting. So how do you traverse that world? How did you, kind of come into this? I know that you said what you liked, but were you expecting that?
Was I expecting to like pediatrics, or was I expecting to like being able to traverse through?
Yeah. Were you expecting, I guess, that you were walking into a predominantly female dominated setting?
When I think I was initially entertaining the ideas and thinking about the different fields itself, I don't think I gave thought to the demographic breakdown of like where I'd be working. Then when I started with the rotations, I realized like, okay, definitely more female based. And then when I hit my hospital when I worked at Children's Specialized, it was like, okay, it's almost all female. I got a little bit in the school too. You could see it there. But I was kind of operating on my own. So I didn't like have a lot of coworkers at that time. So yes, then when I got to the hospital, I was like, okay, the OT is all female except one male. The PT, I was the only male. Speech, I don't think there was a male when I started. So yeah, so that just the whole rehab, particularly pediatrics, is just so predominantly female. Yeah, female dominated.
Did you find that like parents received you differently? Like, were there any challenges with
Sure. Yes, parents received me differently when I was younger in my career, didn't have children, and it wasn't like a specific demographic that would do it or different things. It just maybe people that were brought up a little more traditionally would tend to like view me that I didn't have this like mother's touch and things like that, which I understand. I learned how to navigate that with confidence, and I felt like earlier in my career I would over explain things to just prove that I knew what I was talking about. And then as I got older and realized that you weren't going to change those opinions if they thought maybe you would or wouldn't be as great with their children, I just would be more matter of fact, just have confidence in the information and the education that I was providing. And I found that once I actually just spoke with confidence and almost never let an opportunity for people to kind of second guess me because I wasn't a female in a female dominated field, that either I was blind to it or it just wasn't there anymore, maybe because I just wasn't allowing for the opportunities. And then on the flip side, thank you. And then on the flip side, there were many situations where sometimes people wanted a male to bond with their male child, female child, whoever, just to provide something a little bit different. For example, there were ones that just maybe they had a coach and they responded better to that than they did to respond better to their mom or dad at home. Or there was one where mom was a little bit more of the softie, dad was a little harder. So then with female therapists, he felt like he could kind of push them and he needed someone who was a little bit more like, it's hard to sometimes not to speak in like some of those unfortunate generalities, right? Like everyone can kind of push in their own way, but just it was what worked best. It was always when I was especially in that female dominated team, it was okay if they work best with a female, like awesome. Like we just kind of all found our niche, to be it what we were working on diagnosis wise, what the child had, or maybe who they responded to best. It also could be personality, right? Like it's not just sex. But early on, I definitely felt less confident, and then just as time went on, it just became easier.
Yeah, and I think that's an important point of being able to step in and own what's yours. I can do this. This is mine. Because I do think anytime we talk about a niche specialty, it's intimidating to walk into something where the people there, nobody just stumbles upon peds. If you're stumbling upon something, you're probably an outpatient ortho. You might end up in acute. Like you can kind of go, I don't mean this offensively, but you can go hide in those specialties. When you go to something that's like specialized neuro, peds, youth athletes, like all eyes are on you and it can be very uncomfortable. So kudos to you for like seeing the positives in that and then being able to just step in and do what you know that you could do best. That's
Thank you. Thank you.
awesome for your patients.
Yes, you're absolutely right about the different places that you can hide is a good way to put it, or just even maybe you don't need the same experience in your career to perform those same skills. Not that they're more or less valuable, but you just don't need the same background.
Yeah, and I think a lot of the things that Dr. Young just said and what you said, JT, is some of those challenges also are viewed as advantages. Like I think of times with certain patients that I had that I have said before, like I would love to have a male PT here because like this, we are just really hitting a wall here. I'm not able to do X, Y, and Z. This rapport is just not working. And, talking to parents and like you said, they respond really well to a coach of the male sex, right? And that's not me. So, I think that there are definitely advantages. And for you to be able to push the envelope and create this experience and this expertise and show other people and clinicians and students like what's possible, I think it's absolutely awesome. And again, what Dr. Young said, like your patients and their families are absolutely lucky to have you. What are some of the more common developmental misconceptions you see among patients, or just like misconceptions in general about developmental milestones? And we see a lot of things come out in these big organizations saying like this isn't really important or this is important. Like what are some misconceptions that you typically see among patients that you really try to let families or caregivers know your perspective on?
It's a great question. This is a good one to talk about, and I'm going to take it in two different directions, and I hope that's okay. So, from a misconception, I think particularly with baby development, I actually did a post about it today that a video was showing a father walking his child at 2 weeks old and then continuing to do that over and over. And the misconception that it's good to push these advanced milestones early and that it's good to quote unquote skip these to get to the race to get to walking. The misconception that like it's better if you walk earlier. That would be a big one, or it's better if you're hitting the milestones earlier. As skilled clinicians, we know that just because you're hitting something early doesn't necessarily mean you're advanced. It can mean there's underlying tension. It can mean you're doing one thing better and then you're doing something else, but then you're going to run into a challenge down the road. You want balance, and you want balance with the time that you're hitting the milestones, and you don't want them too early and you don't want them too late. And I just think that's a big misconception that a lot of these families will be pushing for maybe milestones too early. And that's not one I talk about a lot because I feel like the flip side of that is people just being naturally wait and see themselves, not even let alone the pediatricians who drive me nuts with that mindset. But I just think that's not as much of a misconception as I feel like people not wanting to seek the intervention, not understanding what the intervention can do for them, as opposed to the misconception of like actual childhood development. So I thought I would try to take a little bit of a different spin there on that one. And then I think the biggest misconception, maybe even about pediatric physical therapy tied in with development, is that it has to be hard and that you need to have a quote unquote diagnosis or a quote unquote deficiency to actually do pediatric physical therapy. I take pride in the development that Theo and Margot have, and purposeful play is really what we do. And it's actually quite easy if you even know a few things. You don't have to know the depth of knowledge that pediatric physical therapists or even occupational therapists have to purposely play with your child. And many people do it on accident and don't even realize all the cool things that they're doing. But just to know that like it's really quite simple to purposely interact and support appropriate gross motor milestone development. And I just think that it's a misconception that either we're trying to force things early or we're trying to, like, the child's not ready. That component of like they'll figure it out on their own, like we're the ones that are doing these things. And it's like, no, we're facilitating and helping. We're not forcing these different things. So, and that it just requires so much work and time. If you start younger, which is why we always are advocating for intervention earlier, the education earlier on. It's just little tidbits here and there every day that honestly most of us can do. I don't want to say all because I don't want to paint that bar out of a brush, but like that we could do to help our child's development.
I love that point that you made about early milestones and being able to achieve a skill earlier or faster is not always better because that doesn't mean you're doing it well. And I think that can be applied to a lot of different patient populations, but especially kids in pediatrics, because we live in this time where, as a parent, I take pride and joy in my kids. I do. And I want them to be healthy and do the things that they love and be the best that they can be at those things. But also, we live in a world where like being the best comes at a cost sometimes. And I think that mindset starts at a very young age sometimes. So I think that that really creates this misconception, like you said, that being able to hit a milestone early and faster doesn't mean that they're hitting it well. And so that can actually create problems down the road. And I think giving this like educational platform that you have is allowing parents and caregivers and kids too to see what we really can be doing. And it doesn't have to be this highly skilled activity. Like you said, purposeful play. It's is something as simple as that. And there is skill behind it, but it's not this high functioning, high education skill that you have to have. Yes, we all have it as therapists, but parents don't have to have that. They can do it just in their everyday life.
Be sure to sign up for our newsletter linked in the show notes. You can find me, Dr. Young, on Instagram at NeuroElitePT. And Dr. Teig, where can they find you?
On Instagram as well at LTigDPT. Thanks for tuning in to the Rehab Remix, where you listen in and level up. We'll see you next time.